smell the wonderful flowers. And if you have sinus problems or sinus allergies, I just happen to be talking to a doctor right now who knows a thing or two about that, Dr. Raza Pasha, here with us for a few minutes for the Altus Health Update, advances in sinus surgery and treatment. Dr. Pasha, how are you today?
I'm doing wonderful, Michael. Good to have you on the phone today.
Hey, listen, you got some good information I think a lot of our listeners are certainly going to enjoy. Right now, mid-February, how's the air right now? Is this one of the better or worse times of the year for sinus, things and allergies floating in the air?
Well, it actually looks pretty thick right now. Trees are starting to pollinate, and we're starting to get a little bit of grass also. This is the beginning of allergy season. I'm going to get real busy really quick soon.
So many people have sinus problems, allergies, especially here in southeast Texas with all the pollen. What is, and I want you to define this for us if you can, what is sinusitis and what are the causes?
That's a great question because most people that come in and see me, they think they have sinus problems, but really they just have a runny nose or just rhinitis. Sinuses are those pockets that are located in your skull. They're located in your face. They located in your forehead and on the top of the nose. And sinusitis means inflammation of the sinuses. So if you have sinusitis, what happens is you feel pressure in your face. You feel that headache sensation, that fullness you feel in your head. That's sinusitis. Oftentimes people get confused with just a plain runny nose, which can occur from allergies or perhaps just a cold. So sinusitis is a very specific term.
Dr. Pasha, Raza Pasha, joining us over here. Pasha MD, P-A-S-H-A, M-D, pasha.md.com. We'll talk about that a little bit more for more information. Sinus surgery. Now, I don't know how bad your sinuses have to be for sinus surgery, but I hear that's an option for some chronic sufferers. But there's also several, lesser minimally invasive procedures available, balloon sinuplasty. What are some of the options if people really need some help?
Yeah, that's a good question because oftentimes, especially Houstonians that get recurrent sinus infections over and over again and gets treated with antibiotics over and over again, they feel that, well, that's just the way it is in Houston and that's how you're supposed to live. But if that's happening to you, you're not supposed to get recurrent sinus infections, and you certainly shouldn't be being treated year after year with antibiotics. If that's the case, there may be something going on, and maybe something as simple as a plumbing problem. And if that's the case, and your sinuses are not draining because they've been infected for such a long period of time, or for some reason they're obstructed, then you can consider some kind of procedure. And you're right. Even just 3 or 4 years ago, a lot of the procedures that we did were limited to procedures that we do in the operating room, which means you have to go to the hospital and be put to sleep, and then you have recovery time. But now we have new procedures actually that can be performed in the office. And the latest technology, and something that we do quite a bit, particularly in our office, is called balloon sinuplasty. And balloon sinuplasty is a technique in which we stole from the catheter, the cardiac surgeons who used to put balloon catheters in the heart. Instead of having open heart surgery,
sure.
Now they use the wire to the vein to open up the coronary arteries. So we use the same technology, and what we do is we, in the office, we numb you up, much like we do if you go, get, dental work. And then we use a wire to access the sinuses, and then we open up that balloon. And what that does is allows the sinuses to drain properly. And then we can flush the sinuses out, we can clean them out, and the whole, we actually in our office, we've done the studies on this, they stay open. They stay open months, years later. So it's an excellent opportunity for those patients who are looking for a alternative to a surgical procedure, and there's no time off work. I mean, you literally have the procedure done, and you can go right to work that same day.
Dr. Raza Pasha joining me here for another minute or two. Give me the steps. Actually, I've already got 2 emails going in. I think I have one of these issues. What's the first step for someone suffering from chronic sinus problems? They call you directly to get them in for appointment?
Yeah, absolutely. The whole idea of treating this is to treat it comprehensively, and you need to make an appointment and first find out what the cause of it is, and that's number one. I mean, today it's very easy to see even your primary care doctor, and God bless them, but oftentimes they just don't have the tools in order to figure out what the cause of your recurrent sinus infections. So, when you come in, you make an appointment, we often allergy test you to find out if allergies may be the cause. If that's the case, we can treat your allergies. There may be something blocked in your nose. You may have what's called a septal deflection or deviated septum. You may have some polyps in your nose. There's so many reasons. And sometimes it's a quick fix. Sometimes we can do it quickly in the office. and sometimes it requires long-term therapy. But there are more permanent solutions aside from just taking antibiotics and nasal sprays and different types of over-the-counter medication. So to answer your question, the first step is to make an appointment so we can take a look at you and see what's going on with your sinuses. We have to take a picture. We may put a small microscope in your nose, or we may do some simple allergy testing. It all depends.
You have 2 office locations here in Houston. Where exactly are they?
Well, our main office is on Kirby and 59. You can see right off the highway. And then our second office is on Richmond, near West Houston Medical Center. Our main hospital is where we do most of our sinus and allergy, and also we do a lot of sleep and snoring work there too.
Oh, good. All right. So if for some reason I'm sleeping, I can't sleep, you actually can see, you know what, stop drinking caffeine so late at night, Michael, or any other issues.
Well, oftentimes, the reason I do both is that I do a lot of snoring and sleep apnea work, and a lot of times it's just a problem with the nose. So you can't; they're kind of hand in hand. So that's where that marriage comes from. Is that we try to treat the patients comprehensively, I always say from the tip of their toes to the back of their throat. At the end of the day, that's our focus, and we like people to breathe better, breathe freely. There's a lot of Houstonians out there that I find that suffer needlessly, and also bed partners who also suffer needlessly at night because they have to bear witness their partners snoring and mouth breathing and gasping, and that makes for a tough night for both of them.
Marriage counselor also. There you go, Dr. Raza Pasha. Let me give you the website. It's PASHA-MD, PashaMD.com. What's your phone number for your office, doctor?
Yeah, 713-523-8800 is our direct line.
Oh, that's great. Listen, great information, especially this time of year. If people are sneezing or wheezing or whatever like that, check it out, PashaMD.com. Tell them you heard it on the Michael Garfield program, obviously. Part of the Altus Health Group, Altus Help Date. Listen, doctor, thank you so much. Get some Kleenex. We're going to come see you soon.
Thank you, Michael.